Hi, this is Dr. Lara. Today we're going to talk about some common dental problems that people suffer from and how you can handle them and prevent them. Obviously, the most common dental problem that people suffer from is a toothache. Toothaches are typically caused by large cavities that extend into the tooth and they reach the area of the nerve, which is what causes the pain. This also usually indicates an infection, and so it's important that you see a dentist or even an emergency doctor to get a prescription for antibiotics so that you can begin treating the infection. Toothaches almost always will require some type of dental work in order to treat them. When a tooth is infected, it can need treatment like a root canal, or sometimes a very severe infection, the tooth can need to be pulled. But in general, the problem will not go away without dental treatment. The second tooth problem that people can have whenever they are very active is a broken tooth. So this can happen from being involved in sports or activities. It can also happen from accidents or injuries or even fights. People have gotten punched in the face and it will break a tooth. You can see from the photo that we have on this slide that this can be something that is a very big cosmetic issue, but it can also be a problem with the health of the tooth. No matter the size of the chip or the break in the tooth that occurs, you want to try and find the piece of tooth that has been broken off, because there are a lot of times when the dentist can bond that piece right back onto the tooth, which gives you the best cosmetic result and fix for the problem. If the tooth break is very severe and it gets down into the nerve of the tooth, then again, just like with the toothache, the nerve will need to be treated, and so there's more extensive dental work involved. If the tooth is a very small chip from the injury and it's not sensitive or painful, it does not consist of an emergency. And so if you need to take a day or two to get into the dentist, then that's fine. The next one is a true dental emergency, and that's when a tooth is completely knocked out. So this is whenever you have an injury that causes the entire tooth, root and all, to be dislodged from the mouth. These are relatively rare occurrences, but when they happen, it's very important that you act fast. You want to delegate if there are people around. Someone needs to call an emergency dentist. If you're at home, your dentist, obviously. If you're out traveling somewhere, you would want to find the nearest dentist who's open. And then you also want to delegate someone to find the tooth. If you can find the tooth can sometimes be re-implanted, meaning we put the tooth back into the socket. Now, you can do that yourself, and that's actually a good thing to attempt because the socket is where the tooth belongs. There's no better place for it to be. If that makes you a little queasy, or if it seems like the tooth may be dirty or it doesn't look like you could get it back in there, in order to preserve it while you're waiting to get into the dentist, which should be very quickly, within an hour or so, you can store the tooth in a cup of milk. You can store it in a cup of saliva, so if you can work up enough spit and create a level of saliva that would cover the tooth. You can also just hold the tooth in your mouth. I know that sounds really gross, but that's actually one of the best ways to preserve this tooth and keep the fibers and all the cells on the outside of it very healthy and alive so that it can be put back in. The tooth has a better success rate the sooner it is reimplanted into the socket, so you do not want to wait on this one. The more time you wait, the lower the chance of success of that treatment is. When you see the emergency dentist, what they are going to do is, if you have not already, they will reimplant the tooth. They will take an x-ray to confirm that there's no break in the jawbone or the root, and then they will splint the teeth together. So this will usually involve some type of a wire or glue to hold the tooth in place and allow it to reattach to the jawbone. There will probably be quite a bit of bleeding involved in this when you lose a tooth, so you do want to try and hold some gauze to control the bleeding. Now, the next common dental problem that a lot of people suffer is canker sores. Canker sores are also called aphthous ulcers, and they come in a couple different types. A minor aphthous ulcer is a small one that is less than a centimeter in size, usually 3 to 5 millimeters in size, and they last for typically 7 to 10 days. There can be major aphthous ulcers, which are much larger. They can be up to the size of a dime, and they last even over a month. So they're very painful. There's one other type called herpetiform that I won't address here. They're much rarer. With aphthous ulcers, we don't really know what causes them. They are typically more likely to occur when you are under stress, or if you are sick, or when there's trauma. So if you bite your lip, if you have dental work done, that makes you more likely to suffer from one if you are prone to them. Some people are very prone and get them every time they go to the dentist, and others have only experienced them once or twice in their lives. Now, another situation that is similar to canker sores and is often confused with them is cold sores or fever blisters. Now, these are named cold sores and fever blisters because they traditionally have occurred when people are fighting something, fighting a cold or fighting a virus or a fever. And so this is a similar situation to canker sores in that it can occur when your immune system is down, when you're stressed out. The difference is these are caused by a virus. The virus that causes these is present in most people's bodies, and some develop mouth sores from it and some do not. Most people are familiar with cold sores that occur on the outside of the lip. They can also occur on the inside of the mouth, on the roof of the mouth, or on the gum tissue. They start with a slight tingling feeling and then develop into a small cluster of these little fluid-filled vesicles or little blisters. The blisters will burst, creating a clump of ulcers. In the inside of the mouth, it's just ulcers. On the outside of the mouth, the ulcers will scab over and become kind of crusty. Treatment for fever blisters is different because it is caused by a known virus, and so we treat it with an antiviral medication. This medication works best the sooner you start it. So if you can begin to recognize the warning signs of a fever blister by noticing that tingling feeling that starts right before they show up, the little blisters show up, then if you start taking the antiviral medication, they are less likely to get as large and to last as long. With aphthous ulcers, there is no known cure. We just treat them symptomatically. And so whenever you have one that causes pain, we will treat that with something that will just dull the pain until your body heals on its own. There are many other dental problems that people can have. We've listed a few more in the blog, so if you're looking for more information, please read the blog and all of the details there. Or if there's a common dental problem that we did not address here, please feel free to call us and schedule a consultation with Dr. Agarwal. She will be able to answer any of your questions about any dental problems you or your loved one may suffer. Thank you for watching and have a great day.